Nutrition plays an integral role in our day-to-day well-being, but some of us never ask our doctors for advice. So we're taking some common nutrition questions to a doctor. What is fiber?
My name is Dr. Allan Kornberg. Fiber is a sometimes underdescribed and critically important part of every person's diet. It's a complex carbohydrate and something that we typically don't get enough of.
How much fiber do people need?
It depends on age, and men should get a little more than women just based on body size. But for young children, probably about 15 grams a day. For older children, about 20 grams. For adults, 25 to 35 grams a day.
You may be wondering, what is the microbiome?
The microbiome are the bacteria that live in our gut. There's trillions of them. It's really like an extra organ. And so it supports our gut and the rest of our body through digestion, through improving our immune system, also helps to support sugar metabolism and general health. Surprisingly, it seems to have a major impact upon mental health, and particularly on anxiety and depression.
What's the relationship between fiber and disease?
For some diseases, it plays a major role in sugar metabolism. It plays a role around our immune function. It also plays a role in the absorption or the management of the absorption of cholesterol. Eating enough fiber markedly reduces the risk of colon cancer.
So what happens when you see patients increase their fiber intake?
As we get older, it dramatically improves our cardiovascular health, reduces the risk of heart disease, reduces the risk of strokes, it reduces the risk of many cancers, and for the much more common kind of diabetes that we call type 2 diabetes, which is now common in teenagers and adults as well, and also reduces the risk of people being overweight and obese.
What's the best way to boost your fiber intake?
This may sound like obvious, but it's to eat foods that are high in fiber. And so legumes, beans, lentils, and peas, especially lentils, it's avoiding, within reason, highly processed foods. And it's having a diet that's more plant-forward, that's more plant-based, and has less meat.
What other nutrition questions do you have?